am Jacqueline Brown, and I am a program officer here at the Consumer Health Foundation in Washington, D.C. You know that people of color, African Americans and Latinos, American Indians, tend to have higher rates of death and disease compared to whites.
I think I'm more affected by stereotypes than racism, because people really, how do I explain it? Refer to certain situations or things that people do. They'll say, oh, well, only white people do that, or only Hispanic people do that, or only black people do that, and blame it on the race. And I think that's a racist thing to say, and I'm around that constantly, and I don't agree with when people say that.
They're not. So people are like, well, that's just black people for you, those kind of things. That's really like internalizing the negative stereotypes, that have been said about us in ways, that really shows up in how we see ourselves, how we talk about ourselves, how we view ourselves. Way of racism, because racism, just when those kind of assaults happen over time, it causes a lot of stress, and we internalize it in ways that I don't think many of us really realize. But the stress of trying to find a job or keep a job, with worrying about your future, worrying about what it is that, how am I going to eat, how am I going to feed my kids, what kind of life can I have for myself, what kind of life can I give to my children.
I usually say something, or I sometimes make a face if I don't feel like saying anything, because I don't agree with it. But I'll usually say something and try to explain to a person why I think it was wrong that they said that, or how that could be false, or how that could be a racist or prejudiced comment.
If I don't have a job that allows me to buy healthy food, and if there are no grocery stores in my neighborhood where there are healthy foods, and if there are no jobs in my neighborhood that would allow me to afford the healthy food, or afford housing that is clean, and afford to live in neighborhoods, where, there's not a lot of trash, there's not a lot of environmental toxins and all of those things. And really that relates to the kind of policies that are there, who makes the policies that allows for polluting industries to be in communities of color at higher rates. And these are all facts and stats, and I can quote for days, all the information that is out there. But basically, when you just look at communities of color, again, due to historic discrimination and structural racism, people of color tend to be less wealthy, have less education, live in segregated neighborhoods, with access to poorer schools, or schools that are not that good, poor neighborhood infrastructure, poorer housing quality, less access to services, less access to amenities, transportation, and also higher levels of exposures to toxins in the community. So all of this, of course, has an adverse, impact on health. Bloodshot diamonds.